So I just be really quick about this, because one of the things about being the last to speak is that most of the things have already been said. But I can tell you that in my time at running hospitals and health centers, I have attempted to increase the number of primary care physicians by helping to start the family medicine program at Boston Medical Center. I was involved in that merger that created the hospital. I also started a joint residency in psychiatry and family medicine out of the South End Health Center that's now run by Boston Medical Center. I was involved in also in other family medicine kind of programs, because those are the people that actually go into primary care. A lot of internists wind up in specialties. So overall, it's a really important part of the healthcare system that needs to be vastly grown. But that being said, it's already been mentioned that we have quite a healthcare system. I mean, we have biotech, we have innovation, we have all sorts of things that are going on. What we don't have is a system that makes any sense. And that's something that I learned over my 42 years running healthcare organizations, is that the healthcare system is really kind of a modeled piece where, as to quote our current Secretary of Health and Human Services, when the Carney Hospital was closed, she said, "The market has spoken." Remember that? It was all over the Boston Globe and all that. The market has spoken. What the hell market was she talking about? Was it equity market? Is that what we're dealing with now? When healthcare gets turned over to people that their entire purpose in life is to make money, period, and it doesn't matter what the healthcare system looks like, so long as they can pull out any value that comes out of the property and all that. So the Carney Hospital was valued at $76 million when it was sold to the Apollo company for $264 million. And then they had to lease it back at an enormous rate, which essentially created its bankruptcy, right? It was an obvious takedown of that hospital. And now it's still closed, and there's maybe a plan that's coming up on reutilizing it for something. But in any case, right now, what we have is a dead hospital, with the result that the Milton Hospital, which is the next closest hospital, is completely jammed up in the emergency room now because of the 30,000+ visits that went to the Carney Hospital emergency room are now going to the Milton Hospital or the Faulkner or Boston Medical Center, where it's just really kind of a crazy time. But I can tell you that some of the kind of insanity of our healthcare system that needs to be addressed, because it's really built around the need for money on the part of insurance companies. I can tell you that, like, for instance, I had a colonoscopy. Anybody here ever have a colonoscopy? All right. But the colonoscopy is your classic preventive procedure, right? Classic, right? They look inside there, and if you have any polyps that could turn into cancer, they take them out, right? That's the definition of prevention, preventive service. But our insurance companies have figured out a way around that, because it's only preventive if they don't find a polyp. If they don't find it. If they do find a polyp, then it's a diagnostic procedure, not a preventive procedure. According to Obamacare, preventive procedures have to be no cost to the insured. But a diagnostic procedure can do that. So I had to pay $1,700 out of pocket for a colonoscopy, and I vowed at that point that I was going to wait till I was on Medicare before I was ever going to get another colonoscopy, because of this ridiculous thing. I mean, my daughter was pregnant, and her health insurance, right? So does anybody actually look at their health insurance, like the 55 pages that you get that are on there? No, nobody does, right? Not only that, you don't understand it anyway. I worked 42 years in healthcare as CEO level healthcare, and people would come up to me with their bills, and they'd say, "What is that? What's this?" And I'd say, "I have no idea. I really have no idea," because the billing mechanism has nothing to do with cost. It has everything to do with what you think you can get from an insurance company. And the result of that is it really screws people who are uninsured, or people that have to pay out of pocket, or it's out of network kind of things, right? Because what happens then is that you have to raise your rates. And I did this at the health centers I ran, as well as the hospital. You raise your rates up above what you think you might be able to collect, because you have to have like one rate. And then, you bill that out, and some insurances will pay you, on a primary care visit, they'll pay you $64, some pay $168, and some pay $202, or whatever. But you're getting the maximum because you're billing higher than the maximum. But if you don't have insurance, you get billed at that rate, that high rate. And so, of course, it's a bizarre system. It doesn't have anything to do with the actual cost of providing the service. So my daughter was pregnant, and she lived right across the street from the Southern Jamaica Plain Health Center. And she said, well, I want to go there and go to the midwife, right? So she said, could you take a look at my insurance papers, to see if it's going to do it? And I looked at it, and that particular plan, if you went to the Brigham or Mass General to deliver your baby, it was $4,000 out of pocket. $4,000. But if you went to Beth Israel or Boston Medical Center, it was $0. But how are you supposed to know that, right? It's crazy. And then when I went on in Medicare, right? Before you get on Medicare, you get all these piles of stuff. United said something. Oh, they are endorsed by AARP. What a bunch of crap that is. United is the worst health insurance plan that's out there right now. The health centers and the hospitals hate them. They're the worst payers. They deny people at a much higher rate than other insurances. But nonetheless, AARP endorsed them, so a lot of people go with it. But in any case, I had all those, AARP and Blue Cross and the IPAs and the PPOs, as if anyone knows what that means, right? PPO, IPA, HMO? Really, do we really know any of this stuff? No, of course not. But if you look into the details of it, you'll find that one plan, the PPO plan of Tufts, say that, or the HMO plan for Tufts will say that, if you go into the hospital and you need to go into rehab, that the first 5 days are free, but after that you pay $220. And, for the Blue Cross one, it's a completely different thing, or the emergency room copayment, the total out-of-pocket expenses and all that kind of stuff are all essential parts of whether you're going to be denied or going to have to pay a lot of money out of pocket. But nobody knows this stuff, right? It's like nobody's really going to look at it that deeply in order to figure it out. But that's what we are faced with as a healthcare system. You get a job or whatever, and you wind up having to switch around because your employer gets a better deal out of PMC HealthNet or whatever it's called now, the various plans, the insurance companies, and you try to bounce back and forth. When I ran the South End Health Center, we had 97 people that were covered by health insurance. We had a heart attack and a stroke, and so we had a heart attack and a stroke, and another stroke that was the spouse of someone, and so they went up by 28% on our insurance, 28%. So I decided I was going to bid it out to other insurance companies. No insurance company would take us because we only had 97 employees. But guess what? Something like 95% of all businesses in America have fewer than 100 employees. So we're faced with this whole crazy thing of acting like we have some sort of competitive healthcare system. There's no competitive in that healthcare system. We're basically almost all the same, but you can really get screwed if you wind up having an older patient population, maybe with a heart attack or a stroke in there. So we had to pay the 28% in order to try to cut back on the cost of both the patient, the employees, and the health center itself. What we did was we chose a $3,000 deductible, and we would pay the first $500 of it. This kind of bizarre logic that we had to put in place in order to ease it, but also to be allowed to be able to essentially have a health insurance system that we could compete with for employees. Just a crazy system. I'm actually optimistic in a very pessimistic way. So here's my thinking, all right? Clearly the country's gone to hell in a handbasket, as we used to say. The things are really kind of screwed up, and we're losing all sorts of pieces of our government, and there's lots of things happening there. And I think that the kind of overreach of the current administration is going to cause a lot of change. And in that change kind of atmosphere, maybe things can be changed. Maybe we can look at things in a very different way. I remember when right-wingers supported single payer. Does anybody remember that? Right-wingers, why? Because in the old days, right-wingers cared about the cost of things. The Republicans used to care about that stuff. Now all they care about is culture wars. But right now, I mean, in those days, they did. And I was on a television show on Channel 56 way back with this right-wing guy, and we were talking about single payer and why it was a really important thing to do, because we could lower the cost of healthcare in America by whatever percent, probably 50% actually, but it's a large percent in comparison. Or if we allowed the Canadian Army to invade, so, no, wait a second, I think we're invading them, right? But anyway, in any case, but if we wound up with a healthcare system that was like a single payer system, it would cost a hell of a lot less. And that's the opportunity that comes when you have a government in kind of disarray and lots of change happening, that maybe there'll be an opportunity to actually transform a system into a sensible system. Right now, we do not have that sensible system. So that's why I'm optimistic, sort of.